Hi, this is Anna from Vienna Care, and today we will be talking about nasolabial folds, explaining how they form and what you can do to reduce their appearance. Nasolabial creases are these lines right here running from the corners of your nose around the curve of your mouth. When the skin of your cheek starts sagging over these creases, they become nasolabial folds. Everyone has them. For some people, they're a static part of their face, whilst for other people, they become more pronounced when they laugh. That's why they're also called laugh lines. It is very common for the nasolabial folds to become more pronounced as we age. As we age, we lose bone and fat volume, especially all around the area in your cheeks, your nose, and your lips. Furthermore, from our 20s onwards, we start producing 1% less collagen every single year. This means that our skin becomes less elastic, less supple, and saggier overall. This leads to more pronounced nasolabial folds, because we have less bone and fat to support the saggier skin. Nasolabial folds are a natural part of our faces and do not require treatment at all. However, if you feel that your nasolabial folds have become a little bit too pronounced, there are some things you can do. Let's discuss some ways we can treat and prevent these little laugh lines. One of the most effective methods to reduce the severity of nasolabial folds are fillers. Dermal fillers are placed under the skin to effectively plump up the area. When placed under the nasolabial crease or in the upper cheek, it works to effectively plump up the area to reduce the appearance of the folds. Usually, hyaluronic acid fillers are used for this purpose, and the results can be seen quite fast. Fat grafts can also be used to plump up nasolabial folds, but compared to dermal fillers, the procedure is a little bit more invasive. Basically, what happens is that a doctor takes some fat from a viable area, such as your stomach or your thighs, using liposuction techniques. The fat is then processed and injected into the area around the nasolabial folds to plump up the entire area and reducing their appearance. Usually, when you receive a fat graft, some form of anesthesia is required, but compared to dermal fillers, the results are quite long-lasting. Threadlifts are another great way to reduce the appearance of the nasolabial folds. During a thread lift, medical-grade threads are inserted into the skin to lift and tighten the area around the nasolabial folds. The results are often quite long-lasting, anywhere from 6 to 24 months, and there's minimal downtime after the procedure. Let's move on to HIFU. HIFU uses ultrasound energy to heat up the layers of the skin just below the surface. This causes damage, which in turn stimulates collagen production for tighter skin. It usually takes around 4 weeks to see the results of the HIFU facelifting procedure, but the results are quite long-lasting, up to 1 year after just one procedure. Skin resurfacing treatments or microneedling are also great ways to improve the overall skin condition to reduce the appearance of the nasolabial folds. Although these treatments do not directly reduce the nasolabial folds, they do help to soften their appearance by boosting overall collagen production. There are also procedures that are more invasive. A full-on facelift, for example, effectively smooths out the nasolabial lines. During another procedure called subcision, a doctor uses a needle to break up pockets of tissue under the nasolabial folds to effectively restructure the area as well. Nasolabial folds can look more pronounced if the face is puffy or bloated. Facial puffiness can be caused by excess fluids, waste, or toxins that have not been properly drained by the lymph during the night. Simply add a lymphatic drainage massage to your skincare routine every single day to help drain the fluids, to reduce facial puffiness and the appearance of nasolabial folds. Something else you can try is facial yoga, which helps to strengthen the muscles in the face, preventing them from becoming loosier and saggier. When done often, it can help tighten the overall skin as well. Keep in mind that these non-invasive techniques will not lead to a dramatic change, but rather help to keep the skin healthy and naturally tight, which makes them great preventative measures. The best way to treat nasolabial lines is to prevent them from becoming more pronounced in the first place. This means wear your SPF, do your skincare well, and refrain from smoking as much as possible. This helps keep your skin healthy and prevents deep creases from forming. Alright, we hope these tips were helpful for you, and let us know in the comments what you have been doing to reduce your nasolabial folds. Don't forget to like, subscribe, and turn on notifications to stay up to date with all of the Vienna Care videos. Thank you for watching and see you next time.